So this is day 3 going into day 4. It is now Thursday. My surgery was Monday. This is a vlog I'm doing for post-operative recovery from 2 cervical disc replacements. I had this surgery on Monday. On Wednesday, I was able to function without any pain meds. I did take Tylenol on Tuesday night to sleep. It was difficult swallowing. That was the biggest discomfort, I think, dealing with it all. Wednesday, I woke up. I never took any of the oxycodone or the muscle relaxers, so I felt very comfortable in being able to drive my 2 children to school. I ended up only having to drive one. I took her dropped her off driving, and then I came straight home. Later in the day, I was also able to drive. I did a quick errand. That might have been a little bit much because that was a much further drive through the suburbs with a lot of head turning while turning the cars, so that felt a little bit much. My neck did get a little sore from that. I have been maintaining a lot of my exercises that I was recommended to do. The biggest one is the shoulder shrug. You want your scapulas moving in various arm positions. I did that. I have been gently doing my range of motion, nothing crazy, just what I feel comfortable to just maintain. It actually feels pretty good to be able to move your neck. I'm not wearing the collar. I haven't worn the collar since Monday going into Tuesday morning. The collar is recommended as needed for me. Again, for driving, they recommend you don't drive if you are currently taking any medications like the oxycodone muscle relaxers. It's important you realize that stuff is in your system for quite some time, so don't just say, hey, I didn't take it this morning, and go out and drive. It takes a while to get out of your system. So I never really took it other than the first day in surgery, post-op surgery. They gave me an IV drip of medications. I didn't feel after that it was necessary. So I did drive a little bit yesterday, which felt good to get out of the house. Unique to yesterday, Wednesday, I walked on a treadmill on an incline to get some cardio. That felt good because I finally got to open up my lungs a little bit and get some really good air into them, and really helps get things moving along. So that was really good. Later that day, a couple hours later, my wife and I also went for about a 20-minute walk outside, which was awesome. Frankly, I'm a little bored. I know I really couldn't tolerate a full day of work or even a partial day of work and then find out I get stuck there for a majority of the day. So I'm really trying to take it easy with that, just like I'm trying to take it easy with doing anything in the gym. You almost feel like you can get away with doing things, but you know better. The discomfort level is near minimal. I do feel tight as I move towards the end ranges, which is actually good because before that area of end range for me was really uncomfortable on both sides. I would feel discomfort shooting down my traps. Sometimes if I pushed it, I would actually feel the discomfort into my arm. So that's good news. I do feel like the limitation has to do more with this little gauze pad and plastic they put over the incision site. They did say to try to leave it alone, let it stay on as long as it can. It makes sense because it is protecting a pretty large suture site. It goes all the way into your spine, so the more you can wear it, the longer you can, the better you can protect. Yesterday was the first day I was able to shower post-surgery. So surgery was Monday morning. Tuesday weren't allowed to shower. Monday after surgery. Tuesday not allowed to shower. Wednesday was the first day I was told I was allowed to shower. I tried to not get too much water on that area. I tried to take good care of it, and I just pat the area dry with a towel. That's pretty important to know that you cannot shower or bathe right after surgery. It's strange as it sounds. You may feel up to doing it. I actually felt like I could on Tuesday, but they just don't want you to mess with the incision site, getting it wet too early. Knowing that, you should plan on showering immediately before the procedure, regardless. And then I know a lot of procedures are insanely early in the morning, or at least have you going into the surgery center really early. But understand it's gonna be a couple days before you actually get to bathe. So I treated it like a normal day. I woke up, I showered, I shaved, and I got ready for the day. Then I head out to the surgery center or the hospital for the surgery. I think that's important because really you're not going to be able to shower at least for 2 days. And everybody's recovery is different, and you might not feel up to showering for even a few days after that. So why not get the shower in while you can, and it's not going to cause you too much discomfort. A couple of things I did notice. I do have progressive lens glasses, and I do have to turn my head up or down to read. I do feel a little discomfort trying to read with them, like looking up, and you'll see me do that even now, just trying to look at the video. If you do have glasses with their progressive lenses, it is a little difficult. I've been texting with people, wishing me well, and it's been hard to, get to the position to be able to read the screen, and then I look at the texting later, and I realize I really misspelled a lot. Because I'm just trying to avoid looking up. They do have you avoid looking up for the first 2 weeks. Makes sense. The incision site goes this way. If you look up, you're going to stretch out the incision. Obviously, they don't want you to do that. So I'm trying to protect the incision site as best I can. I will say that this is starting to look unsightly. It's starting to peel. If you don't know what's going on, you wonder if the peeling is a person's skin, if you're just seeing it very quickly. So hopefully I'll just wear like a hoodie or something like that to get out the house and out and about. I do feel like it's also a little bit easier to talk today, although I still feel like it's still a little rough in the throat when I'm talking, but it doesn't hurt. So there's that going on. I could swallow, it does not hurt, but I feel like it's just, it takes a little bit of effort, if that makes any sense. No discomfort, but just a little bit more effort to make sure things go completely down. So that's good news. Today I intend on walking again. Yesterday was unique. I got to walk twice, once on a treadmill with an incline, and once again with my wife later in the day. The incline, I did 30 minutes on a treadmill. I just progressively did inclines to get a little bit of cardio. I did make sure while using the treadmill I was not holding on to the sides. I think that will aggravate your upper back and neck if you've got like this death grip on the treadmill while walking. So if you're one of those people who likes to hold on to the treadmill, you should be aware that you should try to avoid that. I'm not big on using a treadmill anyway. I kind of like doing stuff outside, but it is the end of winter here, going into spring, so I really don't want to be outside too long. Although, surprisingly, it was warm out, so my wife and I did take a 20-minute walk a little bit later in the day, which was really pleasant to get out and about and be able to spend some time with her. For today, I intend on doing a similar thing where I'm going to walk on a treadmill for 30 minutes. I'm not going to do much in the way of exercises other than the scapular movements that were asked of me from the rehab protocols that we're following that I also do in my office. So it's just a progressive scapular movements with your arms in different positions, just trying to get the muscles of the upper back and shoulders to move. I can tell you that yesterday I did notice that I do this a lot. I'm kind of protecting my neck. I'm engaging the shoulders, and that causes the muscles to get very fatigued. Dropping down actually feels like it puts weight on the skeletal system, which is the area the surgery was on. And it feels a little weird and uncomfortable to put that pressure on it. So I think that's why I'm doing this a lot. Also there's just that guarded mechanism, just keeping the neck tight. So I'm making a conscious effort when I do these scapular raises to not just pull up, but to actively pull down, not like gravity, just take them down, but pull them down, the lat muscles, which are bigger muscles than the traps, and pull them down to hold it down. And that'll help cause this to be inhibited and relax. So it's a little bit more, and we talk about this in my office a lot of times, it's a little bit more than just raising your shoulders up and letting the gravity do its job. If you let those muscles, those back muscles, pull your shoulders down, these muscles will then get inhibited. It's just how muscles work in the system. If I contract my bicep, my tricep will neurologically relax so that we get full contraction of bicep without any resistance on the opposite side. Same deal. If I raise up with the traps, the lats will relax a little bit so the shoulders go up. But if I want to get my shoulders to relax and go down, I'll engage my lats and my traps will actually relax. So that is a good thing to do to get your trap muscles to relax. It does cause a little bit of a feeling of weight and pressure on my neck from the shoulder girdle, kind of like hanging down on it. But I'm getting more and more used to it as I do it, and it feels okay. So again, today is Thursday, surgery was Monday. I'm feeling pretty good. Frankly, I'm a little bit bored. I don't think I can go a full day of work or half day of work. I might be repeating myself a little bit. I started the video and it got messed up, so I'm not sure what I said first in the video or second. This isn't medication kicked in and not remembering things. I did the video, it got paused, and I started talking again. I think I can work for a little bit. I've been working remotely, calling in the office and doing some things, but I don't think I can handle like a full day or even a half day. The job I have, obviously, once I get in there, sometimes it's hard to leave. So I'm trying to really hold myself back from going into the office right now. Although I think I could probably pull it off for a couple hours. But again, next thing you know, 2 hours turns into 4. My upper back and neck might be too sore from doing that. So I'm trying to avoid that. I did go out yesterday for that drive. It was about an hour there, back, doing my errand and coming back. By the end of it, I felt like it was a little bit much for the upper back and neck. I was feeling a little bit sore. And I don't want it to get to a point where it's sore and then it just has a hard time recovering. So I'm trying to just take it really easy. So today, again, walking on a treadmill. I'll maybe go for a walk outside later today also if weather permits and scheduling permits. Other than that, no other exercises than the scapular stuff. And I'll report back tomorrow. I think it's going to be more of the same. I think we're at a point now where we're just trying to keep the cardio good, get the blood flowing for the healing potential, get the lungs opened up after surgery, which is always an important thing. I talked about that a little bit the other day. And then just more of the same as it progresses. Eventually this thing may peel off, which will be great, but I'll probably cover it with something just to keep it protected. But for now, that's about it. One last thing, I did shave yesterday for the first time and shower. This became a little bit difficult to work around, so understand that that's a bit of a challenge for guys. If you're trying to shave around it, I have to be very careful and where I was applying stuff and shaving. But other than that, it felt really good to be able to, take care of myself yesterday. So that was good. I'll talk to you guys tomorrow. Thanks.